Experts say that this year's flu epidemic is already 3 times worse than last year and showing no signs of letting up anytime soon. This year, it's been deadly even for healthy people, not just the elderly or those with weak immune systems. On this week's edition of Today's Health, NBC's Ann Thompson went to the front lines in this emergency.
10-year-old Nico Malazzi, a 4th grader who loved hockey and the outdoors, mourned today in Connecticut, a victim of this swift and increasingly deadly flu.
Nico's a strong, vibrant, energetic kid.
An active child dying just 3 days after first feeling ill. It caught him off guard, his mother told Time magazine. You have to be aware of your child. One of a growing list of apparently healthy lives ended by this flu. Why is it that someone who seems healthy can die so quickly from this disease?
Sometimes this year's virus seems to be very strong, and there are times when the body's own immune response is sometimes too vigorous,
creating what doctors call a cytokine storm, sending so many antibodies to attack the infection it makes you sicker, resulting in shock, sepsis, and organ failure.
It can actually tip the pendulum and actually lead the body to damage its own organs.
The Maimonides emergency room in Brooklyn reports a 30% spike in flu cases. Every part of the continental U.S. under siege. In New Orleans, emergency rooms at capacity. A 10-fold increase in ambulance calls in Dallas because of the flu. And dramatic jumps in the numbers of deaths. 5 times as many in California as compared to last year, nearly 10 times in Indiana. A deadly outbreak in which being healthy offers little immunity. The best defense, doctors say, is still the flu vaccine. Ann Thompson, NBC News, New York.
In other health news this morning, patients who suffer in-hospital cardiac arrest on nights or weekends are less likely to survive than those who arrest during daytime hours. That's according to a new 15-year study. Between 2000 and 2014, survival from all in-hospital cardiac arrests improved by 9%. But patients who had night or weekend arrests were about 4% more likely to die than daytime arrest patients. Experts say the gap is likely due to hospital staffing and the impact of shift work on doctors and nurses. Another new study finds community involvement in the teen years may have long-lasting benefits. Researchers at Wake Forest University found teens who voted, volunteered, or were active in a cause got more education and made more money as adults. Voting and volunteering were also linked to better mental health and fewer risky behaviors. That's it for this week's edition of Today's Health. And coming up on KPVI News Today, we take a look at your KPVI News Today headlines.